All right, we're going to go ahead and get started. Thanks for logging on, everybody. We really appreciate you jumping on Everhart Advisors University today. Today, we've got Gordon Loudon with us. He's a senior acquisition consultant at RetireMed. RetireMed has been an incredible partner for us for years now. Just a trusted partner and just a vast knowledge of Medicare. So Gordon's going to go ahead and talk about Medicare, which is incredibly complex. I know enough to get somebody in trouble. I know enough to usually just send somebody over to RetireMed. So from Everhart's perspective, they've been phenomenal with people trying to figure out Medicare, what's best for them, enrollment, all that kind of stuff. So we've sent plenty of people over to them and get constantly great reviews in working with them. So Gordon's going to talk a little bit about them. He's an expert in this. Really, daunting area, but super important when it comes to retirement. So I'm going to turn it over to him. Gordon, thank you so much for jumping on. One last thing I'll say, there will be an opportunity for questions at the end. So there's a Q&A box at the bottom of like your Zoom window. You can put questions in there as we go. But Gordon, I assume you'll probably just want to get through everything, and then we'll read through there. I can help you go through it, or you can do it yourself. But you will have an opportunity to ask questions at the end. But go ahead and just put those through in the Q&A box as they go. So without further ado, I'll turn it over to you, Gordon. Take it away.
That'll be great. Thanks so much, Phil. Yeah, we really appreciate the relationship over the years. We've helped, I think, countless Everhart clients at this point. And we're also an Everhart client, so we help a lot of our own employees along the way as they cross this bridge. I will just say right off the bat that I'll ask for a little bit of grace. If you can't tell by my voice, I'm coming off a little bit of illness on the tail end of a cold here, but we'll be able to get through it here. But I might take a quick pause for a cough or a nose blowing, if you will. But yeah, as you said, we'll take questions at the end here and make sure those get answered. But go ahead and get through the content here. All right, so just from an agenda perspective, let me get this all on the screen. We are going to talk about Medicare today. We're going to talk about transitioning to Medicare, some of the considerations to be had with that. I recognize that I'm sure a lot of the attendees on the call may be currently working and maybe working past age 65. What that employer plan versus Medicare consideration comparison looks like. That's a huge part of what we do. A bit more about RetireMed and just sort of how we operate, and then of course the questions at the end here. So real quick, to kick off kind of an introduction to RetireMed, we are a resource for Medicare as well as individual and family plans through the marketplace. Our huge value add is that we are completely a no-cost service. The way that works, since I know that sometimes gets the bells ringing and the lights blinking a little bit, is that we are essentially a broker, and we represent all these different carriers out there. And the way that it works with these federal health insurance plans is that these carriers do pay RetireMed a commission when somebody enrolls onto one of those plans. But the way that we're structured and the way that we're compensated by those carriers and compensate our advisors puts us in a position where we are still able to be completely non-biased. We don't really care what somebody enrolls on. Our goal is to find the product or plan that's going to be the best fit for them based on things like their doctors, their medications, preferences, budget, all those sorts of things. And so rather than the sort of traditional independent agent model where you have a direct single individual being compensated by an insurance company, all of those commissions from those carriers go to RetireMed as a whole, and all of our employees, all of our licensed advisors are full-time sort of W-2 employees that we compensate primarily on salary. Who we help at the bottom here, mainly, I'd say the biggest group traditionally has been the Medicare eligible folks, so 65 plus, whether they are retiring and know that Medicare is going to be their correct option, or if they're continuing to work and wanting to evaluate, should I stay on my employer coverage or should I go on to Medicare, depending on which makes more sense. We help with that. As well as I mentioned that pre-65 or not Medicare eligible, anybody that doesn't have access to employer coverage through their employment. That could be maybe you have a 26-year-old child that is just turned 26. They're no longer eligible for your employer plan. they need to look at an individual plan. If they don't have access to an employer plan through their own employment, we can help them look at that coverage so that they're not in a bad spot. Entrepreneurs, those that are self-employed, don't offer a group health insurance plan or don't have access to one. All those people sort of fall in that bucket, as well as a lot of folks that may be in the position to thankfully retire early before age 65 and needing to bridge that gap from employment coverage to Medicare. Oftentimes are going to look at those types of plans also, and we can fill that need. Okay, so jumping right in, what is Medicare? Medicare is, slide states, a federal health insurance program administered by the Centers for Medicare and Medicaid Services. It's primarily for those that are age 65 and older. That is the magic age when folks do become eligible for Medicare in the United States. That said, there are two kind of groups also that gain Medicare eligibility outside of being age 65. That could be anybody that's on Social Security disability at any age for a period of 24 months. That's sort of a waiting period with the government. That 25th month, they become Medicare eligible and now can look at Medicare plans, et cetera. Excuse me. And then as well as those that are unfortunately diagnosed with end-stage renal disease, ESRD, or ALS, which is Lou Gehrig syndrome, those folks actually get immediate Medicare eligibility and can start looking at those coverage options at that time if you happen to be in that situation. All right, so Medicare today, we're going to be starting with the basics here. I know that when we get into Medicare, as Phil said, it is a complicated beast, if you will. We really want to put everything sort of in layman's terms for folks, and it is best to sort of have these one-on-one meetings with individuals going through it. What I'm talking about today is high level in the sense that it's more the generic rules, the regulations, the facts about Medicare from the government, but each person is so unique that it really does make a difference, as this kind of hones in and gets more specific on an individual basis. All right, so with Medicare, there are several parts, and so it's kind of alphabet soup sometimes. You hear about the A's and B's and C's and D's. We're going to sort of step through that so that you have a good grasp on that. Original Medicare is Part A and B. So collectively, that's referred to, you'll hear me say, Original Medicare. That is just straight Medicare from the government. There's no real selection in that. It's just a matter of if you have it or you don't. There's not different types of Part A or different types of Part B. It is what it is. The coverage is the coverage. That's just what the government offers. Then once you have Medicare A and B, you might look at a Medicare supplement plan, also referred to commonly as a Medigap plan. You may have heard that sort of fills the gaps. There are also prescription drug plans. That's Part D, as in drug, for prescription drug coverage. It's not offered by the government. It's regulated by the government, but you have to get it through a private insurance carrier. And then finally, there's Part C, which are more commonly called Medicare Advantage plans. These are the ones that you hear about more frequently through mailers. Anybody that's turning 65 soon or already over 65 is used to getting all kinds of mail and email and spam calls, probably from not less than salacious agents trying to get your business. And those typically include prescription drug coverage. So all of these we're going to go through more in depth, but a huge reason to look for assistance in this space, given the complication, is, for example, in Ohio, there are over 200 plans to choose from when you start looking at everything together. And I know we've got a mixed bag of folks on the presentation today. That's going to be similar in basically every state is also going to have just a huge offering and a lot to sort through. And when you get all these advertisements and communications from carriers, they are just marketing, right? And they're trying to make their plan on paper look better than all the others and maybe throw out some shiny benefits to you to earn your business. And so the details matter is a big takeaway that I'd have for everybody. And while it might look great or have a very shiny benefit on paper on that advertisement, they might not even have your doctor covered in the network, or they might not even cover one of the prescriptions that you need to be having covered and taking every day. And so looking into it on a more granular level is just extremely important. So kicking off with original Medicare, which again is that Part A and Part B. This is what a Medicare card looks like, just for reference. It's oftentimes referred to as a red, white, and blue card for obvious reasons here. It is what the government sends out when someone has any part of Medicare activated. It simply has your name, your randomly generated Medicare number, indicates whether you have Part A, Part B, or both, and the date that that coverage started. If somebody is, we'll talk about when these might come or how to apply for it in general, but it is something that if you find this in your mailbox, you want to keep it, pay attention to it. It is an important factor of this to know what that number is. Starting with Medicare Part A. Think of A as like admit to hospital. It is generally the hospital portion of Medicare. And typically that's going to be, like I said, being admitted, being fully admitted in the hospital, not anything outpatient. We'll get to that later. The nice thing about Part A is that it is typically premium free for most individuals. So all folks that have had those FICA taxes coming out of paychecks over the years, the Medicare tax on there is what is funding your eligibility or ultimate entitlement to Medicare Part A. As long as somebody has paid those Medicare taxes for at least 10 years or 40 quarters, they are entitled to Medicare Part A at zero premium. So it's no cost. It's something that you just sign up for when the time is right, and then you have it. Listed here last is the 2025 deductible for Medicare Part A. $1,676. This is a figure that typically increases a little bit each year. And the thing I want to call out here is, first of all, not a number to get hung up on, because when somebody has any type of plan, be it a Medicare Advantage plan or a Medicare Supplement plan, it actually negates that deductible. And the cost structure is different. Most people actually don't face that deductible on Part A by itself. However, if someone did have just plain Part A and Part B, this Part A deductible would be in play. And where it gets a little tricky on solely Part A is that most deductibles that we're used to over time through employer coverage or really any other sort of normal insurance plan, it is an annual deductible, so once per year. With Medicare Part A, they have something called a benefit period. And the way that that works is that deductible can actually reset if somebody goes 60 days without using a Part A service. So, for example, if I were to get admitted to the hospital today and I had just plain old Medicare Part A and Part B, I'd pay my $1,676 deductible. And if I, leave the hospital, I'm out 60 days, and let's say I get readmitted to the hospital on day 61, I'd actually have to pay that deductible again. And so it's something that could happen more than once in a given year if somebody doesn't have any sort of other coverage going on with their Medicare. But like I said, typically everybody ends up with a plan that sort of negates that. So it's not a huge figure to get hung up on. Medicare Part B, as in boy, on the other hand, is more of the medical side of Medicare. So think not admitted to the hospital like Part A, but outpatient at the hospital, which could be outpatient procedures, x-rays, outpatient surgeries, doctor's office visits, durable medical equipment, lab testing, things of that nature all fall under sort of the Part B realm of Medicare. And this is the portion of Medicare that does have a monthly premium associated with it. And in 2025, that base premium is $185 per month. One thing that I want to call out here is that is, or rather can be based on an individual's income or their household income, depending on how they file their taxes. As you can see here, it's actually a constant 2-year look back. So if somebody was joining Medicare in 2025 calendar year and it started, the government would actually go and look at your income and tax filing status from 2023 to determine your Part 4 expensive. We have full charts that we can go through to really dial that in and show what you're looking at. They're looking at that line 11 from your tax form 1040 to drive that. And it's not something that necessarily sticks around forever unless income stays that level, even in retirement. But a nice thing here is that if you are a higher income earner, and then you retire and income's going to drop into a lower bracket or maybe even within the lowest realm to have that base premium, you would have the opportunity to appeal that premium and say, or that income adjustment rather, and say, hey, government, I know I made more a couple years ago, but now I'm retiring and I'm projecting my income to be lower. I've had this life-changing event. But again, that's really a one-on-one conversation that our advisors can talk through with folks. Part B does also have an annual deductible, much smaller. It's just $257 for the year. This is calendar year. With that, depending on the plan, it could or could not be a factor. So with most of the Medicare supplement plans, it is something that you'd be responsible for. With the Medicare Advantage plans, it is not. That Part B deductible wouldn't come into play. Your Medicare Advantage plan would just be more so covering that, and you'd have different copays associated with it. But again, in absence of any sort of plan, the way that Part B works is it's essentially an 80-20. The government's going to pick up 80% of your medical costs, and you're left with 20% as your cost share responsibility. The issue with that, and one of the big reasons why people look at plans and why these plans even exist now from a health insurance standpoint, is going to have some sort of cap, like an out-of-pocket limit, maximum out-of-pocket. They're called a couple different things. But what those are they're really kind of safety nets. They're a ceiling, they're a stopping point that if you're having a catastrophic year, if you reach a certain limit, you're not going to pay any more after that, and your plan is going to take over. With plain Medicare A and B, that doesn't exist, and that 20% just keeps going and going and going as you're using services and can open up some serious financial risk that a plan can easily mitigate. This chart that I'm showing here now is something that we commonly share in the meetings we have one-on-one with individuals to sort of break this down. With Part A and B leaving behind that 20% without a cap and all that risk, we really view it more so as a prerequisite to getting a plan. So you've got to have the A and B once you're going fully on Medicare. You're entitled to A, you're paying your premium for B when it starts making sense to. Then you go and look at a plan to fill in those gaps and mitigate that risk. And so I'm going to get more granular on both of the options here, but just to kind of show this chart down in step 2, generally speaking, one option is going to be the Medicare Advantage or Part C route. The other option is going to be the Medicare Supplement or Medigap route to go through. The only other kind of option that could be in play is if there's anybody on the call that has access to a retiree plan option. Maybe you worked for the government or the state or a retired teacher or school employee or some group, and some just aren't, and some are going to do better on a privately offered plan, just a general Medicare Advantage or Medicare Supplement plan. It just matters on the individual's situation. And so even if you think, hey, I've got this retiree plan, I'm going to go down this path, it's worth engaging to kind of see your options. And again, we don't put our employees in a position where it's any sort of pressure to force somebody onto a plan. We are more so in the business, or completely in the business, of figuring out the right option, the right timing, sort of that optimal timing for somebody to go onto Medicare and which plan that is, even if it's not one of the generally offered ones, that we can enroll you on. All right, a bit more about Medicare Advantage plans. So these are typically $0 plans. And when you hear about Part C of Medicare, which is Medicare Advantage, you can almost think about C as in components. With them being typically $0 premiums, that means there's no additional cost to be on one on a monthly basis. You're still paying your $185 Part B monthly premium as that prerequisite, but then you can just sign up for a Medicare Advantage plan that makes sense for your situation. And then you essentially have copays that you pay along the way as you go based on what you use. So if somebody's really healthy, not using a lot of services, they're not running into copays. They've just got the coverage. Maybe they're getting some extra benefits through that plan, like oftentimes some dentals built in, hearing aid coverage, vision. You can see some fitness, over-the-counter allowances for all those things, cough, cold medicine that we might get, all the stuff that I've been loading up on this week at CVS. Oftentimes there's allowances for those, transportation, the list kind of goes on. Each carrier and each plan has a couple different things that they sort of build in to have a more competitive edge on another insurance carrier. And if somebody is a high utilizer and is on a Medicare Advantage plan, it's not a bad thing. It just means that they're going to be running into some copays. but it is first dollar coverage, and those copays are very reasonable as a general statement. We're not talking thousands and thousands of dollars. We're not talking big deductibles. Standpoint, they know, hey, even if I have my worst year ever, God forbid, I'm able to have this stopping point of, oftentimes it could be $4,000 or $5,000 as kind of a common one in many states that there's a stopping point there. That being said, the vast majority of people never even come close to that out-of-pocket limit on a Medicare Advantage plan from a statistical standpoint. Most folks have a lot lower cost expenditure depending on what they're using. Last thing on these is that they are typically offered as either an HMO or a PPO. What those mean is that essentially there is a network. So if somebody has Medicare by itself or Medicare supplement, which we're about to talk more about, there is not essentially a network. You can go anywhere in the country that accepts general Medicare, which is like 98% of the providers in the country. When someone joins a Medicare Advantage plan, that could be the only, potential downside is that you are then put into a network. That said, most of these networks with most of the plans are quite vast. And so that is part of why we ask as part of our research process, who are your preferred providers? What are your preferred hospitals? Even if you're not seeing them today, are there any that hey, if something happens to me, I really know I want to be able to go to Ohio State Medical Center. I want to go to Cleveland Clinic or beyond. We're able to check those and make sure you're in a product that gives you access to the places you want to have. And know that while networks can change, we hear about those in the news sometimes, your plan can change too. And so if you get in a position where, you start hearing that your insurance company at the time is starting to fight with a certain hospital system or network, that is a good reason that we might look at a different product for you for the following year. There's a couple different times a year where people can make a change. And so that's sort of the ongoing relationship that occurs is continually evaluating that and making sure you're in a good spot. Very fancy graphic here. This is supposed to visualize just an ID card. It is one ID card, as I mentioned, doctor, hospital, pharmacy, etc., extra benefits with a Medicare Advantage plan. That red, white, and blue Medicare card that I shared prior essentially gets filed away. You don't have to carry it. You don't have to present it. When you're on a Medicare Advantage plan, everything just gets billed through that Medicare Advantage plan. It becomes your primary insurance for Medicare. All right, moving on to Medicare Supplement, aka Medigap plans. So these are the ones that are also lettered, just to keep it confusing for everybody. You'll hear about plans F and plan G and plan N most commonly. They're all very, very, very similar. So I'm going to sort of generalize them together for purposes of presenting it. But essentially how these work is it's not combining anything. This is working more as a traditional secondary insurance. So if somebody decides to go this path, they'd have their Medicare Part A and B as their primary insurance, effectively covering them at 80%. And for that 20% left behind, one would purchase a Medicare supplement plan or Medigap plan because you're filling in that 20% gap. It does cost an additional monthly premium. So just to very much ballpark that. We've been seeing these premiums increase, frankly, across the board. I'd say it's fair to say for a brand new 65-year-old, most carriers are going to rate it based on your age and gender and where you live. And so that might be a starting premium of $150 to $170 a month additional. So that would be in addition to your Medicare Part B payment that you're paying to the government every month. So it is a higher, monthly cost that you're having. But the nice part about it is that while you're paying monthly, you're essentially paying more upfront versus as you go, because you pay your Medicare premium, you pay your supplement premium, you're effectively covered at 100%. You might pay that small $257 deductible once a year, but after that, on most of these products, you're pretty smooth sailing. And any Medicare approved service, you're going to be covered 100% at. So it's a bit more seamless from a billing standpoint. You're on many of the supplement plans, you're not, necessarily looking out for copays or wondering how much a service is going to cost you. You have more of a sort of budgetable monthly amount that says, okay, I know my cost and I know I'm covered sort of no matter what happens or how many tests the doctor decides they want to run. My cost is quite fixed for the most part. Excuse me. As I mentioned before, there are no network restrictions. So that's another thing folks like. You don't have to think about, hey, if I'm in a different state, does my plan work in that state? If I'm traveling or have a second home, it's just seamless. You don't have to think about it so much. Some of them have some additional benefits. I'd say the main thing is a fitness benefit, like Silver Sneakers, if you've ever heard of that. It's basically a nationwide gym membership. Most of the Medicare Advantage policies are going to have that. Some of the supplement plans do, but beyond that, that's kind of about it. You're not going to see things like over-the-counter allowances or transportation or dental, vision, hearing. Those sorts of things just do not present in a Medicare supplement. They are really, the reason for that is they're completely standardized as far as their structure. So while you get them from various private insurance companies, the same insurance companies that you might get a Medicare Advantage plan from, the benefits are pretty much identical as far as what's covered across the board. It's just the price that that insurance company is charging for it is what differs. And so no, we can speculate back and forth as to what those premium increases will look like. But frankly, nobody knows that. It goes down to that insurance carrier. So if I'm United Healthcare, who's the largest Medicare supplement carrier, my actuaries are going in and seeing, all right, we've got all these people on supplement plans. Here's what their claims were. Here's the premium we're bringing in. What increase do we have to do simply so that we can remain solvent and profitable? That's really all they're looking at as an insurance company. And so we see trends sometimes, but at the end of the day, folks that go on these products have to have a level of comfortability that they don't know what that premium increase is going to be. And the issue with that is that these can be harder to change in the future. And what I mean by that is that when somebody is new to Medicare, they have guaranteed acceptance or what's called open enrollment into any Medicare supplement plan that they wish with any carrier. No medical questions asked. But if I've been on a plan for, let's say, a supplement plan for 5 years, and my premium is now getting out of control, and I decide, hey, I think I want to go look at some other carrier that might save me a few bucks a month, I have to answer medical underwriting questions to be able to do that. So if I'm in great shape, I can go through, they're looking for, chronic conditions that they view as expensive, surgeries that have been recommended but not yet completed, things like that. They might say, no, we don't want you. But if, everything's pretty good and you kind of answer their questions on their application, okay, they'll say, yep, come on aboard. We'd be happy to have you. And so it's just not a guarantee that you'd be able to, switch. And so I have run into clients that might get, for lack of a better term, stuck in a supplement that has sort of a premium that is unaffordable or doesn't really make sense cost-wise. And those folks may end up looking at a Medicare Advantage product because those you can switch annually, never any questions asked on Medicare Advantage. It just kind of depends on, is that a good fit or not? And that's, again, speaks to sort of the ongoing conversations that we have with clients on this front. Medicare supplement plans also do not include any prescription coverage. So if you recall back on Advantage combination, they include that Part D drug coverage. Medicare supplements do not, and so folks going this route do have to pick up a standalone Part D prescription drug plan. Oftentimes that's actually going to be from a different insurance company that you got your supplement through. Sometimes they align. It just depends on your medications and when we do that research and what the costs and copays for those medications look like for you as an individual. These plans do have monthly premiums. There is currently one out there that is actually a $0 premium. We don't know if that's something that will continue or not. We hope it does. Others might be $5, $10, $15 a month, all the way up to in the neighborhood of $100 a month for a drug plan. It just depends on the prescriptions, and there's really not a clear correlation of, if I pay more for my prescription plan, am I going to get better prescription coverage? Not necessarily the case. I've seen folks with 20 medications that they take every day be best suited on a $0 per month prescription plan. And I've seen people with one medication that they take every day that are best suited on a $50 a month prescription plan. It just depends on how that formulary, which is the list of covered medications through the insurance company, it just depends on how that shakes out, how it is dictated by the insurance company for the year, and where those cost shares fall that would drive our recommendation. So those are certainly something that we look at for folks each year when they're on these products to make sure that it's still a good fit for the next year coming. Each year, October 15th through December 7th is the Medicare open or annual enrollment period, excuse me, where people can change Medicare Advantage plans or change prescription drug plans. And so that's our busy season. That's when we start getting crazy here in a couple weeks, helping all of those current clients evaluate and give them that recommendation of, hey, you're still in a good spot. Keep doing what you're doing. Just let it roll over automatically. Or, oh, wait, because of reasons X, Y, and Z, you really need to get on this other product for next year so that you're not overspending. To visualize that route a little bit with the cards here, somebody going the supplement direction would be carrying their red, white, and blue Medicare card. That's their primary insurance. In conjunction with that, at all hospital, doctor, medical visits, you'd be sharing your Medicare supplement card as the secondary insurance. And then when you go to a pharmacy to pick up prescriptions, you'd be showing that third separate card for your standalone prescription plan. All right, shifting gears to the transition to Medicare. Excuse me. All right, so starting with applying for Medicare. Some individuals are automatically enrolled in Medicare Parts A and B through the government, that original Medicare. Namely, that is individuals that before their Medicare eligibility, so before age 65, they're already drawing their Social Security retirement benefits, the cash benefits, or some folks get that through railroad retirement. If you're drawing that monthly retirement benefit from the government before 65, you will be automatically enrolled in Part A and B. It's kind of convenient, frankly, because the card just shows up in your mailbox. You don't have to do any, take any action to apply. It's just there. The only caveat to that is if it's an individual that decides, hey, I'm actually going to defer Medicare. Maybe it's somebody that's working past 65 and we determine that their employer coverage is actually a better route for them. You'd have the option to sort of check a box when you get that card in the mail it back, and they remove the Medicare Part B from it. So that you're not paying that additional monthly premium if you're staying on other coverage for a period of time. But for folks that know they're moving on to Medicare, it's great because step one's already done for you. You don't have to do any further application for A and B. It just shows up. Other situations when you can enroll. So one big one is around that 65th birthday month. That initial eligibility for Medicare is called the initial enrollment period, or sometimes called IEP is an acronym. It's a 7-month window surrounding that 65th birthday month. So 3 months before, the month of, 3 months after. During that time, an individual can basically apply for Medicare Parts A and B. You do that through the Social Security Administration, most commonly online is the way to do it. Social Security kind of handles the application and the paperwork for getting set up on Medicare. So you log on to a Social Security account online. There's a link to apply for Medicare. Pretty simple process. I'd say the hardest part of it is creating your Social Security account and being able to successfully log in. So if anybody does not have one of those already, I highly, highly, highly recommend getting one of those set up now, even if it's not time to apply for Medicare. You're able to go in and see earnings history and all kinds of things. Make sure you're all eligible and looking good for the future. Beyond age 65, so I mentioned, and I'll talk about it more, a lot of what we do is work with individuals that are working past age 65 and get into this conversation of, well, I like my employer coverage. Should I just stay with that or should I go on to Medicare? And it really can go either way. There's several factors that I'll talk about later that sort of drive that recommendation. But sometimes, I would say that we come back and say, yeah, actually, in your situation, the employer plan is better, and you should go ahead and defer Medicare until you ultimately retire or the plan changes or whatever the situation may be. And so if somebody's in that boat, those folks actually trigger what's called a special enrollment period whenever they decide to leave that employer group coverage beyond age 65. So that could be any time of year. That could even be if somebody, they don't even have to be retiring. They could be still working and just decide, hey, I just want to go ahead and get on Medicare now. Your employer is frankly going to be happy to have you off of the coverage because that's a cost savings to them. If they're not bearing, a large part of your monthly premium anymore, they'd say, great, yeah, we'll let you write off and you can go on to Medicare if that makes more sense to you. And again, that's really where we come in, is we're not in the interest of your employer saving money, we're in the interest of you saving money. But the nice thing is that there's tons of scenarios where we are able to kind of create that as a win-win scenario. We'll do that research, and a huge thing that we find very often is, hey, you're going to save money on premium, you're going to have a lower deductible, you're going to have better benefits, your prescription costs are going to be more affordable, and yeah, your employer's kind of winning along the way too. And so, it's nice when that happens, but it just kind of depends. The big thing with staying on Medicare or staying on employer coverage past age 65 is that it has to be employer coverage that is considered both creditable and active. And so what creditable means is it's essentially as good as a base standard that the government sets from a prescription drug standpoint. Most employer group plans that are offered are creditable, but it's always something that we have folks ask their HR department if it's not an employer that we're familiar with, just to confirm. If I'm thinking about doing this, is our plan creditable? That human resources or benefits person at your employer will know that information and be able to communicate it. Active simply just means that you are considered an active employee. You're not, you haven't retired, you're not, passive. They haven't just kept you on this group coverage. You're not on COBRA. You have to have coverage based on your active employment of either yourself or your spouse. Spousal's active employer coverage counts also if you're on their group plan as a dependent. Big thing I say all the time is that retirement is not a requirement for Medicare. And that really just speaks to sort of this comparison that I've been talking about. There's, I think, a huge belief out in the world that, hey, I only go on Medicare when I'm retired, or I have to be retired to be on Medicare. It's simply not the case. We have tons and tons of clients that are actively working past age 65 that are on Medicare. And so when we do those comparisons, get them all on the screen here, there are several, numerous things that we look at. I'd say these are the more, kind of common buckets or factors that we look at. We're going to compare the premium and deductible. How much are you paying out of your paycheck each month or biweekly or however frequently for the employer plan versus how much would your monthly cost be on Medicare? What do the deductibles look like? We live in a world of a lot of high deductible health plans with health savings accounts attached to them. For a high utilizer, they might have to pay $2,000, $3,000, $4,000, $5,000 out of pocket or more before their plan's really kicking in and helping them much. If the price monthly is similar, or even a little more, Medicare with a very little to no deductible might start making a lot more sense for that individual. Is the plan creditable? We talked about that earlier. Income, we talked about that earlier. That IRMA acronym stands for Income Related Medicare or Monthly Adjustment Amount. That is essentially the surcharge that they give higher income earners to go on Medicare. If somebody's making $1 million a year and going to continue to do so, Medicare is going to be more expensive to them. It could start getting in the $500, $600, $700 a month neighborhood. And if they're only paying 100 or 200 bucks a month for their employer plan and they like it, that could be something that favors staying on the employer group coverage as long as they're continuing to work. Dependents. Big thing here is spouses. If you are maybe not yet 65, but you've got a Medicare eligible spouse who's still on your group plan, that might not make sense. You may be paying a lot more for them out of your paycheck than you realize, and they may be able to get better coverage at a lower cost by jumping off, going to Medicare, getting a plan, and you becoming an individual on that group policy rather than having your spouse on it. And finally here, health factors, chronic conditions, prescriptions. These are really things that could go either way. Prescriptions I'll use as the example. I've seen plenty of scenarios where an individual, has a particular prescription or drug that is covered way better on Medicare. Maybe they're paying 50 bucks a month for it on their employer plan. Medicare, it's going to be $5 a month, or completely vice versa. It could swing the other way, and maybe it's a better cost on the group plan, and that's a factor that we'd be considering to ultimately make that recommendation. Okay, do I need Part A in employer coverage? So specifically for individuals that are working past 65, The big thing here are health savings accounts. So anybody on the call that has a health savings account needs to be aware of this. Having any part of Medicare, that's Part A or Part B or both, does not mix well with being able to contribute to a health savings account. In other words, if you have A or B or both of Medicare, you are ineligible to contribute to a health savings account, and your employer is also ineligible to contribute to your health savings account on your behalf. And so if somebody is planning on working past age 65, excuse me, and has that health savings account, wants to be able to maintain the ability to put funds in that account, they would actually have to completely defer Medicare, which is taking no action. It's just not applying for anything. And as long as they don't have it, they're okay and they can keep funding it. The caveat with that is that once you do apply for Medicare in the future, the government, for whatever terrible reason, actually backdates that Part A effective date by 6 months. So you may have heard that, hey, if you're going to be working past 65 and join Medicare, you want to stop HSA contributions 6 months in advance of that. It can be difficult because people don't always know that timing. It could be an unexpected, job loss. It could be an unplanned retirement date, which frankly happens all the time. And so you might not have the luxury to plan that out. But it effectively prorates your annual contribution level. And so it's not the end of the world if you've over contributed, a little bit or for a short amount of time, you can ratify that. But if you're, really on your P's and Q's from a planning standpoint, you would want to halt those contributions that 6 months in advance. Because if you're 68 and a half and you're still doing it, they're going to do that 6-month back date. But if somebody does not have a health savings account, they're just on a more of a traditional employer plan, not even a factor and working past 65, I'd say, yes, go ahead and get Part A. Doesn't cost anything. It's just going to sit secondary to your employer coverage and really might help a little bit if you get admitted to the hospital. But other than that, it's just kind of there. You don't know about it. It's really only a bad thing if you have that HSA and want to continue the eligibility. Part B in employer coverage, I would say, most people are going to be a no for this. Usually when we're meeting with folks, we're recommending, hey, either go fully onto Medicare or stay fully on your employer coverage. There's not really a lot of scenarios where you'd want to have both. It'd be very, very specific. And the main thing would be, it's about employer size. So you can see here that there's a threshold of 20. So an employer size of 20. Any employer that has less than 20 employees, those folks don't actually have the option to just stay on their employer plan and defer Medicare. They are forced into getting Medicare Part A and B upon eligibility at age 65. And so when that happens, it typically makes sense to go ahead and go fully onto Medicare. The only really exception to that would be if you have a younger spouse that doesn't have any other coverage option, needs to stay on your group coverage, then you might have both. But generally speaking, if you wouldn't have both. If you're an employer with over 20 employees, again, I generally just say, no, you don't need Part B and your employer coverage. You should kind of be picking one or the other. Because if you have over 20 employees, that is when you do have the option to go onto Medicare, if you have that creditable and active coverage, or defer Medicare, not pay the premium for it, get it later, and stay on the employer coverage. Okay. We often say it is more than a plan, it's a partnership, and a lot of that is referring to sort of that ongoing support and relationship that I've been referencing throughout. Process-wise, just kind of how we operate. It is, one-on-one meetings that we have with folks. Those could be over the phone. Those could be a Zoom or a Teams call like we're doing right now. We do have 2 physical locations, and one in the Dayton area and one in the Cincinnati area currently. That we do in-person meetings with. Regardless of the medium, we can provide that same experience, give all the same information. Maybe it's sharing a couple things, screen share like this, or doing, emailing a couple PDFs back and forth. But we can always get to the same result and provide that same level of service. While our physical locations are in Ohio, I know we may have some out-of-state people on here, but we do currently service Ohio, Indiana, Kentucky, Pennsylvania, Florida, Georgia, Texas, and we're continuously adding some more to sort of expand that footprint. And finally here, we do have a monthly newsletter. We have more webinars on our website if you want to dive deeper in. But the last thing I'll leave you with here before questions is just a website and a QR code. That is really the easiest way to get in touch with us. There's a form on that site. And I actually put the wrong one on there. It's retiremed.com/Everhart, but they end up at the same place. I'll put that in the chat. Retiremed.com/Everhart gets you to the same place. You're able to kind of fill out a request for information form, start a conversation with us, and just kind of be on our end to see how we can help you. All right, want to get into some of these questions?
Are you able to pull up the Q&A box, Gordon?
Yep, I do. I see it.
Okay.
All right, automatically enrolled in Part A and Part B. I think that may have come in before we got to that, but just to touch on it quickly, the answer is yes. You are only if you are drawing Social Security or Railroad retirement benefits prior to age 65. Other than that, it is not an automatic enrollment. Next one here, I'll be 64 and a half on October 22nd. I'll be initially registering through RetireMed before March. Not expecting to move forward until age 68. Thinking about not switching at 65 because of employment compensation includes fully paid family medical benefits at no cost, excluding plan deductibles. Is there a penalty for me when deferring the move to Medicare? That's a perfect example. When we're comparing those group plans, if you're offered a group plan at absolutely no cost for your entire family, that's absolutely something that's going to be favoring the group plan. I have had scenarios where, maybe that deductible is really high. Maybe even though it's not a monthly cost to you, you're, having higher costs for services or something like that. It could, it's still worth looking at it, but if you're, pretty status quo, feel like everything's good, then absolutely, as long as that is considered creditable coverage and you are an active employee, absolutely no penalty for deferring it. But I agree, it's great to just kind of open up the communication with us and, kind of have that on our radar. We're really good about keeping notes in our system so that, as we interact with you over the coming years, we know kind of the thought process and where we're at and we're on the same page so we can kind of pick up where we left off. If you do the Medicare Advantage plan, do you still pay the Part B premium? Absolutely. That is, think again of it as a prerequisite. So you're still going to pay that Part B premium. It's the Medicare Advantage plan itself that is a $0 premium. So when you see all the advertisements of 0, 0, 0, 0 Medicare Advantage plans, do know that you're still paying that premium in the background. If somebody is drawing, because I don't think we covered that, if somebody's drawing Social Security at any point when they're on Medicare, that premium is going to come automatically out of that monthly check or benefit. The government's just going to take it. You'll never see it. If you are not drawing Social Security and you enroll in Medicare Part B, they actually default to a quarterly bill for that Medicare Part B premium, although they also offer an option called Medicare Easy Pay that you can set it up as a monthly checking account draft to pay that Part B premium to the government until you draw Social Security. Is there a benefit for spouses to be on the same Advantage plan instead of plans tailored to each individual? No, frankly, other than kind of keeping things straight. So if it makes sense for both, it's nice to be on the same plan in a household because you're not starting to confuse each other's copays or networks or benefits. You kind of can support each other as in the household to make sure you know what's going on. On supplements, there could be a benefit because some of the supplements do offer a small, maybe 3, 5, 7% household discount if both spouses are on the same supplement plan. But with Medicare Advantage plans, no, it could be a nice to have, but it's, totally plausible that we might come in and say, hey, you're really best suited on this, Anthem plan, but actually your spouse here is best suited on a United Healthcare Medicare Advantage plan for whatever reason, just because you're individuals and might have different doctors, different providers, medications or needs. Great question. All right, I'm still working, turn 67 in March, plan to retire in July 31st. When should I apply? Government layoffs mean I should apply earlier than the past. So the window is still going to be, you really can't do anything until you're 3 months in advance. And so, if you're retiring July 31st and presumably having that employer coverage until July 31st, your Medicare target effective date, if you will, would be August 1st. so you can start making moves in May. I would say that, there could be benefits to, potentially even looking at doing it in January. It could make perfect sense to stay on your group insurance as long as you're working. But, if you do something like fulfill a deductible or meet an out-of-pocket maximum just to switch to Medicare mid-year, now you're kind of dealing with two plans within a given calendar year, which, might not be the best financial thing. It just depends on your plan benefits. So I'd actually encourage you to, kind of have that comparison meeting, sooner, maybe in November, December, if you haven't already, to see what those plans look like for 2026 and make that decision of, all right, am I going to wait till May to apply for August, or maybe I just want to make a clean break now and move to Medicare. Does the special enrollment period apply to both Medicare Part A and B if still working and covered by credible health coverage? Yes, absolutely. The main thing there is that the Part B is forward-looking as far as when it's effective, but again, that Part A will go 6 months retroactive. But yes, you get both. Turn 65 in December 2026. Is it best to start Medicare around January 2027? So good question. Your and 69-year-old husband will be changing at the same time. So with Medicare, it actually starts the first day of your 65th birthday month is your first day of eligibility. The only exception to that would be if your birthday is the first day of the month, then it actually goes a month prior. My birthday is October 1st. My Medicare starts September 1st. So if your birthday is any other time in December, your eligibility starts December 1st. So it could make perfect sense for you and your spouse to get off your group coverage and start Medicare for December 1st of that year. Or you could do January. You kind of have the option either way. And that's where I would say, in the neighborhood of September, October of that year, get an appointment with us, sort through it. And, I used to manage our sales team. I kind of trained them and all those advisors of, we are trying to find and help individuals identify what that optimal time is for their Medicare transition, for that Medicare effective date. And they'll kind of talk through pros and cons on that with you. Can you use your HSA to pay your Part B premium? Absolutely, you can, which is a great thing. So if you've got all kinds of money in that bucket, you can reimburse yourself for that Part B premium. So even if it's coming out of a Social Security check, or you're paying them separately, you can use HSA funds for it. With quick note on that, just for a general answer, there are almost everything with Medicare you can use those HSA funds for. So if you're on a Medicare Advantage product, you can reimburse yourself for Part B. You can pay all your different copays with it for prescriptions and medical. On supplement plans, though, the premium for a Medicare supplement plan is about the only thing that you can't use HSA dollars for. So if you just decide to go that Medicare supplement, Medigap route, that additional monthly premium for a supplement is not eligible to be paid with HSA dollars. 54-year-old UK citizen living in Columbus with a US green card and been working in the US for over 8 years. Would I be eligible for Medicare at 65? I believe that yes, because I believe it's 10 years, if I'm not mistaken. I was just dealing with that a few months ago, and I don't want to butcher the answer, but yes, for over the next 11 years, and you've already got 8, you absolutely should be eligible for Medicare. And premium-free Part A, I believe you will also be eligible for, because you'll have enough years in the bank at that point to be entitled to it as a permanent resident. And can we email you questions later? So let's see, can I put something in here? So our general email is advice@retiremed.com. That's probably, a great way to just get in touch with our team and email general questions, and they're really responsive on there. Again, that's advice@retiremed.com. Myself, I work with Everhart. My dad, Kevin Loudon, is actually the main contact for Everhart. So if you have questions, I think it's fair to filter them through Everhart to us also, and they'll kind of get them where they need to be. But yes, absolutely feel free to reach out. We're not trying to push you into an appointment or anything. We're happy to answer general questions along the way.
I just shared the advice@retiremed.com on the webinar, on the chat feature.
Thank you.
So you can pull it up there. But if that's it, no other questions. Gordon, thank you so much. That was wonderful. So I really appreciate it. It's a difficult thing.
Absolutely.
It's a lot of content. So thanks for taking
It
the
is,
time.
it is.
Yeah, and we've so Gordon sent over to us what we will forward on. So what will happen is we'll send out a recording of this like we always do, and then Gordon also included the 2025 complete guide to Medicare. So we're going to be sharing that. It's a phenomenal document, tons of information in there. So you should all be receiving the recording in that document tomorrow. But again, I can't stress enough. Utilize retirement. I mean, we get great responses and feedback, everybody who's used them. So thank you, Gordon. I appreciate your expertise and your time.
Absolutely.
And thank you everybody else for jumping on the call. And next month, October, we're going to cover Social Security. So a lot of people on this call probably should come on over
Absolutely.
and check that out. So thank you so much, everybody. Thank you, Gordon. Have a great day.
Thanks so much. Have a great day.